us Alex and Antonella. They are researchers from Institute of Fiscal Studies, London, and they are here for their study related to community toilets in Lucknow and in Kanpur. We'll be asking a few questions to Alex and Antonella. One question which I want to ask you all is why do you choose India for your study? Like for your research, why do you choose India?
So we were generally interested in understanding the role of sanitation within slums. We originally selected a few other countries. Clearly, this is a widespread problem around the world. We were trying to focus on certain countries in Africa or India. And of course, most of these countries are focusing some limitations in terms of infrastructure and access to sanitation, specifically in slums. So in the end, we decided, together with our partners, to focus on India. The reasons are pretty general. So we were interested in sanitation, and of course, India, specifically in slums, presents different limitations which we were interested to address.
So, yes, Antonella.
I would add that India is an ideal setting to study this because of the externalities from sanitation.
Yes.
And India has a very high population density in which health risks are exacerbated. So we found this as an ideal scenario to try to change behavior and hopefully see some health outcomes also.
Okay. And during the research, you must have come across several challenges. What were those challenges? Can you just give us a view on that?
Well, major challenge was to put in agreement all the partners and all the actors, stakeholders, which we needed to address. It was not easy to get an agreement or get in touch with everybody, but we finally been successful, at least until this stage, in putting together a very good team which is collaborating. The second main constraint was to try to get in the field and find some data which was not available, which is, for example, the distribution in the cities of community toilets. So at the very beginning, we knew we wanted to work with community toilets, but we didn't know how many, we didn't know who was managing them, where they were. So these were the main constraints at the beginning of the
Same with
project.
the households, because slums are, as I said, densely populated. So you have one household after the other, and we did a listing of all the households surrounding the community toilet within slum areas, and that is a major
challenge. What do you aim to achieve after this research? Like, what is your aim, the objective of this research of yours?
So,
Antonella,
as I was saying before, our main aim is to change behavior. So, sanitation is a supplies and demand side challenge. So, from one side, you have to provide infrastructure, good quality, and maintain it. From the other side, also households need to demand for it and need to use it. So, community toilets have been widespread constructed in India. However, households are still practicing open defecation or relying on different quality, bad quality, sometimes of sanitation facilities shared by neighbors when they have better sanitation facilities who are not only providing a space but also service of maintenance, of cleanliness. So this is what we want to try to aim in the study. And first of all is understand what is behind this changing behavior. What can we do? Is it information? Is it that the quality of the community toilet can be improved? And then it's also try to understand how much these people will be willing to pay to use this community toilets, which is the willingness to pay, because it's very important that all of them contribute to maintain and give a good general service for the whole population who are the users.
Anything on that, Alex?
No, this is actually our aim.
Okay.
The objective of the project is purely to measure impact and understand behavior in a very scientific way.
So apart from behavior and impact, like if you want to make a policy change, you need to, incorporate the government into it. So, how do you see the government? How do you incorporate the government into your study? I just wanted to ask.
So, our main role is definitely to put the science into the intervention. So, trying to quantify in a very clean way the impact of certain intervention on behavior. Clearly, this is not enough. We also want to have policy impact, and this is, of course, a very important part of our project. We have to say we cannot do it by ourselves, right? So, in order to get influence, we definitely have to rely on the local partners, which are working day after day with policymakers. We have stronger links, and it's important to work together. So we bring, let's say, the academic side, the scientific side, and we work together with the team, with all our partners in order to try to influence policymakers.
So far, we're already engaged in the government because some of these community toilets are managed directly by agencies of LACNO and Campo Municipal Corporation. So they are updated on the study. Of course, we receive their approval. And we want them to feel engaged in this study and to use the findings of this study to improve the management of these toilets, to improve their link with the population, to help in pricing policy. And we hope this is gonna, like, right now keeping updates is gonna wake up some curiosity to see the findings, and then at the end have them already engaged, and then go to higher and higher levels to be able to have a larger impact at the policy level.
Thank you so much, Alex, and thank you so much, Antonella. That would be all. Thank you.
Thank you.